might have to jump off and then drive to work, where we have really good university Wi-Fi. So anyway, um, today we will talk a little bit about common diseases and vaccinations of North American equids. Um, I am, well, we'll get there in a second. You guys are welcome to take notes. I can also send you guys the slides to this afterwards. I'm happy to share that. The pictures in it are pretty much all on from like online. And there's a couple pictures that I have to take out because they're of client owned animals. But definitely we can go through things. And I can get you slides if need be. The content of this presentation is kind of, veterinary aimed. I tried to make it as relevant as possible for what you guys are going to be doing and kind of the knowledge base that you guys need to know. But by all means, if you ever see something that's contradictory in your references, so the only thing that really pops into my head is the horse industry handbook. I don't know if that's still a reference or not. But sometimes I felt like the things that they would say were maybe not the most current, but they're going to examine you on those resources. So if I say something that contradicts those resources, follow the resource, not what I said. What I'm telling you is kind of the most up-to-date veterinary literature information that we have. The other thing to mention, this presentation was also made initially for 4-H people, and then it kind of got converted into vet students at my last job. So I've tried to make it not over your heads too much, but if it is, stop me and I can explain things further and try to take it a step back. So anyway, I'm Noah Carello. I am currently an intern veterinarian at Cornell Ruffian Equine Specialist, which is down in Long Island. So just a little bit about me. I am from southeastern Massachusetts. I'm from Rehoboth, if you guys know where that is. I grew up riding hunter jumpers primarily, and was pretty active in 4-H kind of from the time that I was like 12 onwards through the time that I aged out at 18. So that top left picture is my horse that I used to have. That's actually from State Show. So diehard 4-H'er. I was on 3 nationals teams for 4-H. So I was on the hippology team in 2015, which is that picture at the Barbaro statue. And then I was on the horse judging team the year after, and then the horse bowl team the following year. If I think some of you are from Southeastern Mass. I'm a Bristol Aggie kid. That if any of you guys go there or know there, that picture is old at this point. Those buildings don't exist anymore, which is sad. But yeah, and I've known Kate forever. Love Kate to death, and you might run into her if you go to UMass and you ride on the team, and she might come to one of your horse shows one day. So that bottom picture is somebody that I'd gone to nationals with on the left. And then Kaylee and I, so Kaylee's on the right, her and I were on the same 3 nationals teams all 3 years. So you meet some great people, you have a lot of fun. But anyway, this is just kind of some references to what I do on the daily. My last job, I worked in Missouri at the vet school there. So you see lots of foals and all the different types of intense medicine cases. But I primarily want to be a surgeon in life. So there's lots and lots of surgery things that I do. So the castration that we did on the horse that you can see cupping his testicle. And then there's a nice horse colon from a horse that we operated on, did colic surgery on 2 weeks ago. And then my little pony that she was discharged today. So, all the fun things, cutting into horse heads and clearing out all the pus in there. But enough about me. Today, we will talk about kind of core versus risk-based vaccines. And then we'll talk a little bit about the diseases that are associated with our core vaccines and the diseases that are associated with our risk-based vaccines. And then there's a couple slides at the end about diseases that we don't have vaccines for, but are very, very relevant in horse ownership and also for what you guys need to know. I'm realizing now that when I converted this presentation, I did not talk about core versus risk vaccines as the previous presentation had. So just to kind of set a little bit of groundwork, a core vaccine is something that we talk about that every individual in a population should get. So your old horses, your young horses, even if your horses never leave the property, they don't come into contact with other horses, every individual should get these vaccines. And now core vaccines vary by the region that you're from. In the United States, we primarily talk about our core vaccine being triple E, where so Eastern equine encephalitis, Western equine encephalitis, tetanus, West Nile virus, and rabies. Um, the other side to them is what we call a risk-based vaccine. So this is kind of you're taking the risk-benefit analysis of, okay, is my horse exposed to other horses, or is there a particular pathogen in a particular area that is of prevalence, and my horses are at significant risk of contracting that disease that maybe other horses wouldn't be. We'll go on to talk about some of those. But does that all make sense at this point? So core vaccines, everybody should get them. Risk-based vaccines, only the individuals at risk for that disease should be getting those. Is the simplest way to think about them. So kicking it right off into what we call triple E, or officially Eastern equine encephalitis. So this is a viral disease that is primarily located in the eastern United States, hence the name Eastern equine encephalitis. So you can see in that map there from a 2019 data set that USDA had published of the distribution of triple E cases in the United States. Now, that's not to say that the states in the gray didn't have those cases. They could have just not been reported, or maybe the horse didn't see a veterinarian and then they weren't reported. But again, primarily Eastern in the East. It's transmitted by mosquitoes, so it's a vector-borne disease. And horses are kind of the dead-end host and are not really intended to contract the disease. They are kind of they get infected accidentally. So the triple E virus is not that it's intended, but for the most part, it's intended for birds and rodents are the primary species that it's kind of meant to affect. Do you guys know what the term zoonotic means? It's okay. So if you're not familiar with the term zoonotic, that basically means it's a disease that can go from animals to people. And then what we would call a reverse zoonosis is a disease that goes from people to animals. But so zoonotic disease, it's primarily in that mosquito. And then, what happens is that mosquito bites a prey animal or an animal that is its prey and for a blood meal. And then they infect that animal through the process of them sucking their blood. So people can get it too, and you will hear of usually it's like one case a year, I feel like, up in Massachusetts or the Northeast of a human that contracts triple E. Direct transmission from horses to humans does not exist. So where I said that they're kind of a dead-end host, the horse contracts it, but if you had a horse with triple E, you can't get that from them. And if you think about when the disease is going to happen most commonly, if you think about your peak mosquito months, kind of your mid to late summer, and at this point, into the autumn, is going to be their prime time for triple E infection. And just to break down the word encephalitis, so a lot of these diseases are named after kind of what they cause. So encephalitis is inflammation of the brain. So cephala is the head, and itis, inflammation, N is within. So within head inflammation is just inflammation of the brain. Oops, that doesn't like that. Let's see. So this is just a really simplified schematic of how the triple E vector and reservoirs act. Again, starts with the mosquito and is primarily aimed at birds, and that's the vicious cycle that it goes through. But sometimes that triple E infected mosquito is going to bite a human or a horse, and they become an incidental host. So, as we said, it's a disease that's going to cause inflammation of the brain. So it's going to affect the nervous system. Um, these horses can present with fever and depression are typically the first things that you see. And then if you think about your nervous system, they can have kind of increased muscle twitching. Um, if it's acting centrally in their brain, they might have impaired vision or complete blindness. They Animals really like to do this thing what we call head pressing. So if you have a really really bad headache and you know what's happening in theory. Oh, I don't feel good, but horses or other animals will do this too, where they sit there and they actually it's exactly as the word sounds, and it's in this picture here, is they press their head into usually it's a fence or a wall or something, and that's almost their way of trying to cope with, oh my God, my head hurts so badly. So that's a pretty bad sign if you see an animal head pressing, and that's not always associated with just triple E, but it is something that commonly affects or comes kind of hand in hand with it. Again, if it's affecting the nervous system and your brain is what tells your body how to live its life. So you can lead to inability to swallow, paralysis, meaning that you can't move, if you think of the word paralyzed, and then leading to convulsions and death. There is no specific treatment for triple E, and so really only supportive treatment is indicated. So essentially, you're going to keep these horses hydrated. You're going to try to, give them pain medication, and then keep them in a safe environment or as safe of an environment as you can. Unfortunately, the survival rate for triple E is really, really low. So 80 to 90% of these horses do succumb to the disease or are euthanized because of the secondary effects to the disease. A lot of these horses are found recumbent. So the word recumbent means that they can't stand up. Horses are really big animals. If they can't stand up, the weight of themselves, they can impinge on nerves, and to the point that if you fall asleep on your arm, you wake up and you can't move your arm. That totally happens to horses and other large animals, and for them, it's not good. Sometimes they recover from that, sometimes they don't. But also just the fact of their sheer size, they literally crush themselves, and it leads to their muscles aren't getting the correct blood flow, so their muscles start to break down, and then you have all these knock-on effects of all that. So, unfortunately, take home, triple E, not a great survival. The good thing to that is that our vaccinations are really, really effective to this in preventing the disease. So most horses that are vaccinated for triple E are never, ever, ever at any chance of developing the disease as long as they've been vaccinated appropriately, and continue to receive their yearly or 6-month boosters, which we'll come on to in a little bit. Mirroring on from triple E, we also have Western equine encephalitis. So this virus gets its name because of its distribution being primarily in the western part of the United States. It is essentially the same as triple E. The survival rate though is a little bit better than triple E, but again, it doesn't carry a very good prognosis in general. And then again, just to kind of put a definition to the words that I'm using, prognosis meaning kind of their outlook, their long-term or short-term or long-term outlook on their recovery, or coping with that disease. Thankfully, something that we don't see too frequently in the United States, but is relevant to probably more South American equids, but also Central America, is what we call Venezuelan equine encephalitis. So outbreaks, like I said, are typically kind of localized to Central and South America, Mexico, and then very occasionally the Southern United States, primarily Florida. Florida is warm, humid, similar environment to that kind of central Southern America, but also, there's horses that do a lot of traveling coming into Miami, So maybe they're coming in contracted with it, or there's a mosquito that's infected with it somewhere that, has been able to transmit the disease. So again, transmission and the manifestation of clinical signs is very, very similar, and is essentially the same as triple E and Western equine encephalitis. This one doesn't really fit with um, core vaccines, and this is really a risk-based vaccine. So you're really only going to vaccinate your horse for Venezuelan if you live in Florida. I have a friend who lives in South Carolina, and she was like, "Oh my God, my horses need to be vaccinated for Venezuelan." It's not a thing out there. Nobody vaccinates for it. They don't see cases. You can see from this map on the right the kind of generalized distribution of where we've seen Venezuelan cases. Um, I'm not sure how old this map is, to be honest, and I'm not really sure who put out the data. So probably bad on my part. But that one very random case in Colorado is not really, I don't have a good explanation for that. That's probably the horse traveled from somewhere warm where the disease was endemic, um, and just happened to have the clinical manifestations of the disease out of the environment that it typically occurs. The word endemic means that a disease is basically it's in a specific region and it's not going away. So, what we call or consider foreign animal diseases are diseases that are not endemic. So we don't have them in a particular area, whereas an endemic disease, the disease is here and it's not going anywhere. And Venezuelan encephalitis is a reportable animal disease, which you guys probably don't need to know. But as veterinarians, we have to, um, if we diagnose something and this is a disease that could prove financially, prove large financial challenges and also animal welfare challenges. So we have to report that to the government if we diagnose a horse with it. So that's just a little tidbit there. And then the final encephalitidae is how we call them. But diseases affecting the brain that are vector-borne and that we vaccinate for would be West Nile virus. So it's similar to all of the above cases. However, West Nile needs a very specific species of mosquito. So historically, people thought, oh, when we're in the north, we don't really see West Nile, or, West Nile is, located more in the southern parts of the United States because of that temperature that mosquito needs to live its life cycle. Um, Unfortunately, it is essentially all over the continental United States, most of Canada and Mexico. So West Nile is endemic. It's here to stay. And it's something that we just unfortunately have to deal with like we do with triple E and Western encephalitis. The mortality rate for West Nile virus is better than it is for the other diseases. However, in my own experience, dealing with these horses that have come in and are West Nile positive, they typically don't do very well. They're, again, if you think the horse can't stand up, their mentation isn't correct, they don't know what's going on. They're really big animals. It's dangerous for them. It's dangerous for everybody involved with taking care of them. A lot of these horses are euthanized. But so maybe that 33% mortality is a generous number. But of the horses that survive, up to 40% of them have lasting effects. So whether they have behavior abnormalities or gait abnormalities, that particular study followed them for up to 6 months following the diagnosis of West Nile virus. So these horses could have lifelong deficits, but from this study point in this data, they can only say up to 6 months after recovery from the disease. A little interesting picture. So this is a horse that I saw back when I was in Missouri, actually about a year ago. She presented with another horse. It was a really weird case, really weird situation rather. But this horse was mentally not appropriate. She was what we would consider obtunded, so conscious, aware, well, conscious and able to move around and quote is living, but kind of similar to the term "the lights are on, but nobody's home." She was not aware of her surroundings. She was head pressing. She had a very, very low temperature, which we see this in the end stages of the disease. These horses tend to be what we consider afebrile, um, which means without a fever. Something very, very classic for West Nile horses, and unfortunately, you can't see this in this picture, but they have what we call muzzle fasciculations. So fasciculations are essentially like twitching or shivering, but in West Nile cases, they're really localized to the muzzle. So you'll see their muzzle going back and forth, almost like, if you scratch a horse on the withers and you kind of get them going and they want to start social grooming you and their nose is going. That's what these horses tend to do with no stimuli whatsoever. Um, just to give you guys a little bit of a background on this horse, or kind of what happened to this horse, if you're interested. She essentially was head pressing. She was hypermetric, so she would stand there planted like she is in that picture and then launch herself forward like a lipizoner. Um, it took us 45 minutes to get her from that big steel door behind her, kind of 100 feet down the hallway of the hospital, into one of our padded recovery stalls. She was also down on presentation, so she was, recumbent in the trailer. We had to get her up. You can see that she's really traumatized herself. And unfortunately, this horse we did end up euthanizing, but came back very strongly positive for West Nile virus. And this horse was very much a rodeo that at the end, if we have some time and you're interested, I'm more than happy to tell you the story, but I won't sit here and kind of harp on to that because it's not really relevant. But that is the first horse that I euthanized as a veterinarian. So anyway, moving on to something that's maybe a little less depressing, but I feel like all of these topics are not always the most fun. We are going to talk about tetanus. So people typically associate tetanus with, oh, it's a rusty nail disease. And I'm going to come back to that rusty nail in just a second. But the condition tetanus is caused by a bacteria called Clostridium tetani. And it's obligate, so meaning it lives freely in the environment, and it's anaerobic. So that means it lives in an environment without oxygen. It's gram positive, which just means that it has specific characteristics to how you can stain them in a lab. And the disease causes, or the bacteria is a spore-forming bacteria. So basically what happens is you can see all these little like peanuts on the screen here. These are all tetanus spores, and that's how they go on to cause disease. So the bacteria themselves are not what cause the disease, but any of the clostridial diseases that you hear about, or we'll go on to talk about one other of them, they cause the disease by releasing endotoxins. So the bacteria do their little things and then they release these toxins, and those toxins are neurotoxins. So what ends up happening is, they cause muscular blockades, so your muscles don't work appropriately, and that's how we get the clinical manifestation of the disease. Circling back to the rusty nail situation, again, if you think about where do most rusty nails hang out, in the ground, in the dirt, um, in an environment that lacks oxygen, where these spores can lie dormant, until they come into contact with a wound, and then that wound starts to heal and creates another anaerobic environment, and then the spores go crazy. So it's not the rusty nail that's causing the disease, it's the tetanus spores that live on the rusty nail in the ground that are causing the disease. It can live in the environment for years. And thankfully, it's not contagious. So, meaning if one of you develop tetanus, which I hope you never do, that you can't go and give it to your friend. It's basically a singleized disease process. So, common sites of infection that we see in tetanus is typically associated, again, if you think of those rusty nails, puncture wounds. So puncture wounds are going to create a little opening, and usually a much bigger tract of trauma through the skin or into the deeper tissue. And then what happens, because there's more damage on the inside where the wound happened, and just a little teeny tiny exterior defect, that exterior skin is going to close up real fast, and then it creates that anaerobic environment, and those bacterial spores have a heyday. It's also common to see with any sort of surgical incisions or wounds, lacerations, or exposed tissue even. So if you think of umbilicus, there's the umbilical cord, after birth, or retained fetal membranes, or just fetal membranes in general. It's really, really important that these animals are vaccinated for tetanus. Because those can serve as what we call a nidus for infection. So a nidus is something that the disease can essentially attach to, and it's going to help give that disease a route into the body to cause an issue. So if we have any Quiz Bowl people that have joined, or if any of you guys go on to do Quiz Bowl, these are like the key flag words to tetanus: lockjaw, sawhorse stance, third eyelid protrusion. So lockjaw, because what's going to happen is these muscles can't contract, or sorry, they can contract and they can't relax. So you get what we call spastic paralysis. The toxins, like I said, they block that. They cause your muscles to contract, and then they block them from releasing. So your muscles work by basically, it's a bunch of electrolyte chemical channels that flip back and forth, and they polarize and depolarize for your muscles to work. So the tetanus toxins are blocking that from happening, and that's how we see the manifestation of disease. Sawhorse stance is, we'll come on to some pictures, kind of 2 feet in each corner of the stall. And then third eyelid protrusion is the classic sign for these horses. So if you ever see a horse that's sitting there like flipping its third eyelids back and forth for no reason, if a horse blinks, their third eyelids will go up. But these horses sit there and they just flash their third eyelids, flash their third eyelids. That is almost certainly a tetanus horse, or any animal for that matter. The incubation period for this disease, so incubation period meaning the time that it takes from introduction of the, in this case, bacteria, to the time that it causes clinical manifestations of disease, is on average between 10 to 14 days. The big thing with tetanus, if we think about that muscle contraction, so the paralysis starts in the area usually local to where the wound occurred, where that bacteria started to produce its toxins. This paralysis can, travel through the body, and then, you can have focal tetanus, which is located to a specific area. If you catch it really, really quickly, that's good. You can usually treat them in the focal areas. But if it continues to progress, they develop what we call generalized tetanus, which is really, really dangerous. And the way it kills animals is because it paralyzes your muscles for respiration and essentially causes you to not be able to breathe, and you die of asphyxiation. So if you think of the big thing is, we say muscles of respiration is the diaphragm. So your diaphragm is what divides your chest cavity from your abdominal cavity, and that is basically how your lungs are inflating and deflating every time. So that muscle contracts and creates a vacuum in your chest, and that's how you inhale, and then it relaxes and you exhale. So this basically, the diaphragm contracts, and then it doesn't relax, and you can't move air, because if you can't move your diaphragm, you can't move air. Top left picture, very, very classic sawhorse stance. So the kind of 2 feet kind of stretched out, parked out in a sense. The right image on the top is the third eyelid. So usually that should sit down pretty low into the medial canthus, so the part of the eye that's closer to midline, or the nose. But in a normal blinking horse, you close your eye, that third eyelid will come up, also called the nictitating membrane. And that serves as it produces a lot of the tear film and helps to kind of cleanse the eye when they blink. But in these situations, it causes that muscle to contract and not be able to relax. So you get third eyelid protrusion. Some of these horses, it's not funny, but it's funny to sit there and watch them because they'll sit in a stall, and if you start to get them riled up to anything, you're getting ready to feed them, you see them and their third eyelids just track back and forth, and it's we talk about it all the time in from a 4-H standpoint, from a veterinary school standpoint, and when you see it in real life, it's actually wild. But again, it's going to lead to a generalized disease state. And the horse in the bottom picture is recumbent. The horse is unable to stand, and you can see how rigid its legs are. And also its head and neck are really kind of held extended. It can't relax itself. And that horse is what we would call circling the drain. Um, Another kind of thing just to think about going back to other common sites for it to happen. I have personally seen 2 horses that had hoof abscesses that were not vaccinated for tetanus. And 3 weeks after they had a hoof abscess, they presented with generalized tetanus. Thankfully, both of those horses went home. Um, and my intern mate at my last job was the tetanus queen because she saw both of them. And tetanus horses typically don't leave the hospital. It's a very, very serious disease, and the fact that we're now starting to be able to catch these horses and treat them in a way that's really effective is really good. Moving on to rabies. This is another big one. It's a really important one. It's a really scary one. I would say rabies is arguably the most scary out of all of the diseases we're going to talk about today. So rabies is a virus that affects the nervous system, and specifically the central nervous system. It is spread by carnivores, um, and I'll caveat that with that is the primary way in which it spreads things, or it's spread from animal to animal is through carnivores. But if a horse contracts rabies and then you go get its saliva on your hands and it gets into a cut on your hands or it licks your face, you can get rabies from them. It's not a dead end host situation. You will hear people say, oh, you get rabies from bats. Bats have in somewhat of a higher prevalence of having rabies. And that seems to be the most common thing that, especially in North America, is our reservoir for rabies infection is bats. Um, that's not to say that rabies is exclusively caused by bats, but in the US and North America anyway, that's by far the most common. We've done a really good job at vaccinating animals across the last, 80 years. And we've really decreased the number of rabies cases significantly. But in other parts of the world, rabies is a really, really big public health concern. My little public health disclaimer, if you ever go to other countries, mainland Europe, kind of Eastern Europe specifically has a lot of it. Southeast Asia should not be going and petting dogs and random cats because if they bite you and they have rabies, it's not good. It's transmitted through infected saliva or bodily fluids, and hence why we see it often in bites. So it's in the saliva, the animal bites you, it breaks the skin, the infected saliva gets into your bloodstream, and rabies goes crazy. And the unfortunate thing with rabies is it is 100% fatal in animals if they contract it, and in people, it is 100% fatal if you start to display symptoms of it. So if you're bit by an animal that is unvaccinated or you suspect has rabies, by getting the prophylactic post-exposure vaccination series, that is really, really effective at preventing rabies infection in people. That's not something that we have in animals, but again, the key thing to that is that you have to get those post-exposure vaccines before you display symptoms of rabies. Because once you start to display symptoms, it is 100% fatal. This is a nice map of kind of the distribution of rabies and countries with higher or the risk level of certain countries. You can see North America is relatively low risk. There are very few places in the world that have no risk of rabies, pretty much only being, what is that? I think Japan and New Zealand is really, they're island nations, things like that. But you can see across most of Africa and kind of Southern Asia, they're considered high risk countries. So the tricky thing with rabies is that the disease can occur kind of days to months after the initial introduction. And initially signs are pretty vague. So in horses, we might see, colic signs, which I feel like we say with every disease. Um, for you guys to think about colic signs, um, I'll start with saying colic is not a disease, but colic is a symptom of typically abdominal pain. They are going to look at their sides of what we call flank watching. They might have a phlegm response, so where they flip their upper lip up and kind of make the smile face. They could paw at their belly. They might want to roll. They might just be not want to eat, be dull and depressed. So colic signs, super, super vague. Um, but once these signs appear, they rapidly lead to paralysis and then subsequently death. There are what we consider two forms of rabies, although there is only one causative agent, and both of them are kind of linked together in these two forms. So what we classically think of as, mad dog syndrome, furious rabies, is that wild animal who's foaming at the mouth and super aggressive. So this part of the disease causes extreme agitation. And like I mentioned before, this could be mistaken for colic signs or is primarily actually also causing a colic. In the furious rabies phase, they may actually what we call self-traumatize themselves. So they, grab their leg and bite their leg or essentially almost chew their leg off. That's more of a kind of a cat thing that they want to chew their body parts off. But horses absolutely will, bite at their sides and their flanks to the point that they're literally ripping skin off of them. There was a really good video on Facebook 6 months ago of a horse in Arizona that had furious rabies. I can try to find if you guys have interest in it. But it was intense. Furious rabies then goes on to fall or turn into what we call dumb rabies. Dumb rabies is the more common form of rabies that we see in our herbivore species, so horses included. And this is where, they're a bit quiet, they're a bit dumb, they don't really know what's going on. And this leads to a paralytic form of the disease. So it's going to cause the paralysis of the throat and jaw muscles. So this is where we see that foaming at the mouth. They're unable to swallow because the muscles of their pharynx or their throat aren't working. So they kind of just have this excessive salivation, and their mouth is continuing to produce it, but it's got nowhere to go. They might have a drooping lower lip, and now that's not to say that there's a lot of horses that have those droopy lower lips. They might just be chill dudes. Um, Most of them are just chill dudes. It's not always associated with rabies, but it is one symptom that has been reported in the literature. And then something that's really specific to cattle, but can also be seen in horses is poor anal tone. So essentially, what that means is if you've ever taken a horse's temperature, you go to put the thermometer and they kind of like clench down their anal sphincter on it. So that's what we call anal tone. Horses that have rabies sometimes basically will have poor to no anal tone, where that muscle doesn't contract. Again, older horses have poor anal tone. It's not always associated. It's not a definitive my horse has poor anal tone. They have rabies, but it's something that can happen with the disease. And then just some public health importance. It causes tens of thousands of human deaths annually and 29 million. And I'm actually not sure what year I put this from, but 29 million people worldwide receive post-exposure prophylaxis vaccination. Maybe that's supposed to be every year, on average, 29 million people. So that's quite a lot of people. But you know, it's a really big disease. So very, very important to think about rabies. Now we'll talk a little bit about the vaccines that we can do for the core diseases. So there are kind of a few different options on the market, and I'm not going to get into all of this because you don't need to know it. But basically, we can vaccinate horses for just tetanus. There is classically what people will refer to as EWT West Nile. So that's that bottle with the blue top on it. So that vaccine is going to cover Eastern encephalitis, Western encephalitis, tetanus, West Nile virus. So that's what we call the four-way flu. No, sorry, not flu. That's the four-way in West Nile innovator that historically most people have used. Now, in the last kind of 5 years, the Zoetis, which is one of the drug companies, has come out with what we call Core EQ. So this is essentially one needle poke that covers EWT West Nile, but also has a rabies vaccine in it, which is really nice because it just makes it a lot easier to only have to put one needle in a horse. But historically, what people have done is the horse gets a rabies vaccine with what we call an IMRAB. So that's that bottle all the way to the right, IMRAB, large animal rabies, and then an EWT West Nile. And those two vaccines are going to be your core vaccines that your horse should receive every year. I'm not going to get too in depth into vaccination schedules because you probably don't need to really know it. But the overall arching theme of vaccination, foals, if you know where they've come from, say you bred the mare was well vaccinated, the foal nursed its colostrum and got good antibodies and had good IgG after birth, they really only need to be vaccinated kind of between 2 to 4 months old initially. And that's because the encephalitis vaccines are pretty short-lived. They really only last about 6 months. So we want to make sure that your horse has good coverage. Because the foals are what we would consider naive, so they have maybe not received the vaccine before, or they definitely have not received the vaccine before. Their immune system may not really be partial to what the vaccine is trying to do. So what that you want to give that vaccine initially, and then you want to give a second dose 4 weeks after that first dose. And then for a foal or a young horse at this point, they're kind of weanlings, close to yearlings. You want to give that third dose at 10 to 12 months, basically aiming for that peak season onset. Adult horses, you're going to vaccinate once a year. Again, ideally, right before your peak season. I feel like historically people are like, oh, we'll do our spring vaccines in February. Okay, well, peak mosquito season is what? July, August. So February, March, April, May, June, July. You're talking 5 months after the vaccine that your horse is then going to really be encountering the disease process or the disease in the environment. So really, you don't want to vaccinate them much earlier than like March, April. But for those horses that it has a really high incidence of the disease in the region, it's not wrong to vaccinate them twice a year. And that's where we get those 6 monthly spring and fall vaccines from. Your pregnant mares should be vaccinated annually as they are healthy adult horses. But also you should aim to vaccinate them again 4 to 6 weeks before they foal. And that's aimed at that vaccine is going to help throw those antibodies into that mare's colostrum. So that 4 to 6 week pre-foaling window is that prime time for the mare to be creating her colostrum. And that colostrum is liquid gold. That foal is going to stand up and needs to drink 10% of its body weight in the first 24 hours. Ideally in the first 12 hours, but by 24 hours. And that's going to give that foal an immune system until 2 to 4 months, 4 to 6 months even, when their body starts to develop their own immune system. So they're born very, very fragile. They have literally no immune system foals and any baby animal for that matter are very, very susceptible to any disease in the environment because their immune system is naive. Rabies vaccines, you're going to vaccinate your horses annually for that. Some species, we have what we call 3-year rabies vaccine, but that's very dependent on the local legislation. So all large animals, and specifically, actually, I'm not going to say all large animals, scratch that. Horses, you have to vaccinate them yearly. And pregnant mares, again, you should vaccinate 4 to 6 weeks pre-foaling. Think of that colostrum. And then foals, you're going to vaccinate again at 4 to 6 months and then annually. So I'll stop there for a second. That was a lot of verbal diarrhea. Do you have any questions at this point?
I have a question.
Yeah.
With tetanus, how fast after the symptoms like set in does it progress?
It can progress very, it's very rapid. So the way in the cases that I've seen, these horses, and so I work on at a referral level, so I'm not seeing them on the primary as the primary. Usually you get a call of like, hey, this horse was like acting a little weird, or usually, oh, the horse's third eyelids are going. It was fine yesterday, its third eyelids are going today, and it's recumbent tomorrow. Um, it doesn't always happen that fast. Sometimes you have kind of a week of a slower onset, but once it starts, it just rolls with it. So typically pretty fast. I'd say between 48 hours in a week and 7 days. Any other questions? No. Okay. If you guys think of stuff, we can circle back always. So moving on to some risk-based vaccines and the diseases associated with them. What we'll talk about that are the most relevant for kind of the hippology stuff in most horse owners is influenza or flu, EHV or what we call rhino, strangles, botulism, and then Potomac horse fever. Kicking it off with equine influenza. Influenza is a respiratory tract disease, and this horse influenza is caused by a mutation of the influenza A. It is endemic to most of the world, honestly. It's definitely endemic to North America and Europe, but really anywhere that there are horses, you're going to have flu, just like people. And also, like similar to people, it's highly, highly contagious. So it's going to spread through aerosolized droplets, which really are associated with coughing. You think it's going to live in the respiratory tract. It's going to cause inflammation and irritation to that respiratory tract. And then the horse is going to cough and it's going to blow influenza particles all over the place. You guys lived through COVID too. I guess I don't know how old everyone is. Maybe I'm aging myself there, which makes me very sad to say that. But similar concept. The other thing with influenza is it can be transmitted through what we call fomites. So a fomite is an inanimate object. Typically, it's a pair of shoes, it's a brush, it's a broom, it's a pitchfork, it's a rag that those aerosolized droplets sit on. And then, for instance, if it's a rag, oh, I'm gonna go wipe this horse's nose with it, and then I'm gonna go throw it on the tack trunk. And oh, actually, that horse had flu. And then you didn't know that. So then you circle back and you go, oh, that other horse has a snotty nose. Let me grab that rag and wipe that horse's nose with it. Well, you've just inoculated that horse with influenza. So that's a fomite. People are great fomites, on your clothes, on your hands, things like that. Some clinical signs of influenza, again, super vague, but you'll see fevers, enlarged lymph nodes. So your lymph nodes are going to be kind of your filters of your immune system, and that's what's going to help clean up things and get your immune system to work on these diseases. And then, oh, there's a little chat thing. Maybe there's a question. Oh, that was Kate saying, yes, there has been team effort problems on EHV. So we'll come on to EHV in a minute. Other things that influenza will cause is edema. So edema is essentially just kind of fluid pooling in different parts of the body. If any of you guys have seen horses that stock up, stocking up is just distal limb edema. But they can get it on their ventrum, so on their bellies. Geldings, they'll get sheath edema, where their sheath swells up to this massive thing. They can get it under their chins. Basically, if you think of anything that's gravity dependent, that fluid leaks out of the vascular space, and then it's just going to pool, and it's gravity dependent. It doesn't want to click. There we go. So snotty noses, really, really common with influenza. And I would say the most common thing with influenza, or what you'll hear people refer to as flu, is coughing horses. If you go into a barn, and it's usually a sale barn or an auction barn, or you go to a horse show and everybody's coughing, your spidey senses should be going off because you probably have a flu outbreak. Again, that's not to say that every time a horse coughs, it's got flu. It could be dusty in the barn, or what for whatever other reason the horse is coughing. But if you go somewhere and everything's coughing, especially in a highly concentrated environment like horse shows, sale barns, auctions, things like that, it's probably flu. So yeah, that is essentially the equine influenza. Now we're going to move on to EHV, or equine herpes virus. So there's a whole bunch of different herpes viruses all out there in the world. There's a bunch of different equine-specific herpes viruses, but the two that we're most concerned about is EHV1 and EHV4. These are the two that cause the most clinical diseases. They're probably the most common, and really they're the ones that we're testing for. But to kick it off, EHV1 and EHV4, they can both cause subclinical to severe respiratory disease. And this is where you get the term rhinopneumonitis. So if we break down that term rhinopneumonitis, rhino meaning nose or upper airway, pneumo meaning the lungs, and then or lower airway, and itis. So essentially, you're getting inflammation and infection of the upper and lower airways. Most mature horses have developed some degree of immunity to the respiratory syndrome of EHV. It's really, really common in young horses. It's something that the horse becomes exposed to it, and usually it's, subclinical or really low-grade disease that their immune system is able to kick into, into gear and take care of it. And that's that. The thing with herpes viruses, though, is that they really like to lie dormant in your tissue. So you'll get over the disease, and then it will go hide somewhere away from your immune system, inactivated, until a time of stress. And then it goes, aha, this is the perfect time for me to reemerge and wreak havoc. The more important forms of EHV are the abortogenic form, and then more severely the neurologic form. So the neurologic form, or what we call equine herpes myeloencephalitis, is basically they develop neurologic signs as a result of damage to blood vessels in the brain and spinal cord. And issues with this blood supply cause tissue damage and subsequent loss of function to specific areas of the brain and the spinal cord. Neurologic herpes horses are usually recumbent, and if they develop neuroherpes, it's not good. It's really, really contagious. If this happened, you might hear sometimes in the news in the horse world, oh, this hospital shut down, or this horse show had to quarantine because there was neurologic herpes. It's a really big deal. It's not good. Any of the herpes viruses can, in theory, cause EHM, but it's primarily associated with it happens usually in association with EHV1. And so we don't have a good reason as to why some horses develop EHM. It's really random. Not all horses that have EHV1 will develop EHM. A subset will. And actually, there was a recent paper that was talking about vaccinations and equine herpes myeloencephalitis development. And it actually, so, we typically vaccinate these horses every 6 months for herpes if you're showing in a an environment likely to transmit it. But this paper basically found that if horses had received more vaccines over the course of their life, they were actually at higher risk for developing the neurologic form of herpes compared to horses that were not vaccinated or not vaccinated as frequently. Again, that will definitely not be on your exam or in the horse industry handbook, but that's just a little interesting tidbit that was really interesting that we all had a very academic discussion about at work because it was cool. But moving on from kind of the respiratory disease to the abortogenic form. So essentially, EHV1 is going to cause abortion storms. This is the really contagious form where you'll have a whole herd of broodmares drop their fetuses. Whereas EHV4 is associated with isolated events and is not really considered a contagious risk. So your horses are going to, you might have one broodmare that slips her foal, but everybody else is okay. Um, Again, if you have a horse that aborts, and this goes for really any species, though animals typically abort because of an infectious disease, and those infectious organisms really like to set up shop in all of those fetal membranes, in the fluid, in the amniotic fluid, in the fetus itself. So those tissues are really, really, really contagious. So you should try to isolate the animal, really try to do your due diligence to clean up all of that material and disinfect the area that it happened in so that you don't inadvertently contaminate or infect your other animals. There's no way to know EHV1 versus EHV4 abortion unless you test those aborted fetuses or fetal materials. So EHV abortion can occur 2 weeks to several months following infection. And like I had said earlier, typically, we see herpes viruses in young animals that overcome the disease. But for whatever reason, herpes viruses really like to lie inactivated into the tissue, and usually some sort of stressor. Pregnancy is considered a stressor on a physiologic level. And maybe in a non-physiological level as well. But so some degree of stress to the body, it's going to cause that virus to reemerge, and then you can see clinical manifestation of the disease. These abortions are typically occurring in late pregnancy, so greater than 8 months gestation. But on that note, what is the gestation period of a horse? Somebody answer, please. I don't want to, I don't bite, I promise. Anybody? You know it. I know you do. Not in days. You can give me months. Days are more complicated.
11 months?
Yeah, 11 months. Follow-up question. How long is a donkey pregnant for? Is it the same or is it different? I'll share that one. So donkeys are typically pregnant, really vague, 11 to 13 months. Um, so that is essentially a little bit longer. Donkeys are different chromosomes. I'm sure, as you guys know, they're a little bit different. Um, but yeah, and actually, while I'm thinking about gestation, if you guys aren't aware of this, um, we say that that's their gestational period is for a horse, for instance, 11 months. There are some horses that fall out much later than 11 months. There are some horses that like to hold on to their fetuses for a very long time. We don't ever induce horses, and or well, we do, but it's really dangerous and it's not really worth it unless there's a reason, a really good reason. But in horses, we kind of, as long as they seem healthy, the fetus looks okay on ultrasound, we let them go and we let them cook for as long as they want them to cook. Because if they're born before they're fully ready, you have a whole slew of problems that we won't get into because that could be a 3-day long talk. And I'm not an internist. So anyway, um, classically, these are the three things that we're going to see with EHV. So respiratory disease, nasty, snotty noses. Sitting horses are really, really commonly associated with EHV and the neurologic form. So you think that they literally just can't move their back ends. Again, I know horses that sit like this randomly. I'd say it's actually not normal for a horse to sit like this. Like there's a reason they're sitting like this, but not every horse that sits like this has herpes. Um, and then, kind of classically aborted fetuses. So you have the placenta at the bottom. It's kind of in that three clover shape that then all kind of curls together into your umbilical cord, and then you have the fetus there within the amniotic sac. So to prevent these diseases, we have this lovely thing called a flu rhino vaccine. So this vaccine is going to cover EHV4 and EHV1, as well as influenza A. So these vaccines are typically only given to horses that are showing, they live on boarding facilities, they come into contact with a lot of other horses, or maybe you have an old horse that lives at home, but you also have another horse that you show and you take off property and do things with. You'd probably vaccinate everybody because that old horse is at risk of the disease because of that individual who moves around a lot. Um, the other important thing, and I don't think I have a picture in here, I don't, but we really want to vaccinate our pregnant mares for EHV4, and that's what we call pneumobort, which is a vaccine that we're going to give to pregnant mares at 5, 7, and 9 months of gestation. So a little bit of vaccine schedules. We're not going to get into them. They're all pretty much the same as what we've discussed previously with, for instance, your EWT West Niles. The only caveat to that is flu and rhino, both of them. And the top table is actually incorrect here because it should also have this little green highlighted box that the rhino does. Some horses, specifically show horses, you're going to vaccinate them up to as frequently as every 6 months. And that actually can come down even onto an organization level. So like FEI requires your horse to have a flu vaccine within the last 6 months. And if it's a day over, you have to restart the series, and it's all the big thing. But that's just because it has a lot of importance on the global platform. Another lovely respiratory disease is strangles. So strangles gets the name, and you'll understand why it gets the name in a minute when I show you some pictures. But historically, strangles used to the disease causes a lot of inflammation in the back of the airway and the lymph nodes around the throat, to the point that they used to get so big that these horses would literally strangle to death because they couldn't breathe. Thankfully, in most parts of the country, I would say, we don't see the severity of the disease that we used to. Texas, might I add, is a very different place. Having worked with several people who are from the wild, wild west, they still see some really, really bad strangles cases out there. But it is caused by a bacteria called Streptococcus equi, subspecies equi, and it is highly, highly, highly infectious. It's typically going to infect your young stock more than your adults, but your adults are also susceptible to the disease. Young stock are primarily going to get it more than the adults because they don't have any sort of immunity to it. And it can be spread by direct or indirect contact. So direct contact would be, nose to nose with a horse. Whereas indirect contact would be, I put a booger on that rag and then threw a fomite, touched another horse, and then that horse contracted strangles. A little bit of an anatomy lesson. So in the right image, you have kind of what we call sagittal section, so cross section through the middle of the horse's head. So you can see the mouth and the nasal cavity. And then we get to this area in the back of the throat, which is called the pharynx. And horses have this really unique little thing that we call a guttural pouch. And it's actually an outpouching of what would have been, or the horses have it too, we as humans don't have it, would be what's called the eustachian tube. So your ear is connected to the back of your throat. So if you think when you go on an airplane, your ear is blocked and you have to like, squeeze your nose and blow or swallow or chew a piece of gum or whatever. And what you're doing is you're equalizing the pressure between your throat and your eardrum. So the guttural pouch is this really weird, there's no good reason for a horse to have it, pouch in the back of their throat. And Strangles really likes to colonize this pouch, and horses can be subclinical carriers of it. And outwardly they don't have any what we call lymphadenopathy, so they don't have swollen lymph nodes. They don't have any nasal discharge. They don't have any fevers. They're totally outwardly they look like normal horses, but inside their guttural pouches they have the Strangles bacteria hanging out. They're really moist environments. It's a humid environment. It's a very warm environment that has no sunlight. Perfect bacterial breeding grounds. The other thing that can sometimes happen is they get these guttural pouches full of pus, and then you get these inspissated pus rocks that form, and then you end up with what we call chondroids, which are literal pus rocks. And those are constantly shedding the bacteria because the bacteria are living in them. So, yeah, that's a lot more information than you ever need to know. Maybe you'll get a question about guttural pouches, but that's just kind of some relevant Strangles things. The picture on the right is what we would call, so that's like a view of the upper airway endoscopy. So that's like we shoved a camera up the horse's nose. And you're looking back at the larynx. So E are the two vocal cords essentially. D at the bottom is the epiglottis. So when the horse swallows, the epiglottis is going to flop up over the larynx to protect the airway so that food can move down into the esophagus. And you can kind of see that's kind of here. So your esophagus is up here. Can you guys see my arrow? I don't know if you can see that or not, but they're going to swallow, the airway is normally open. The epiglottis is down. So air goes through, but when you swallow, the epiglottis flops up to cover your airway, and then you swallow your food bolus over that. So that's this part down here. And then these two slits here are the openings to the guttural pouches. You can drive your little camera scope into the guttural pouches. It's quite fun to do. And then this picture on the left is the inside of the guttural pouch. It's a very scary little pocket. So you have a bone here. This is the stylohyoid bone. So that's part of the bone that suspends your tongue. And then you have some really, really, really big, scary blood vessels. This is your this is your external carotid artery. This is your internal carotid artery. So this is pumping blood directly from your heart up to your head into your brain. And yeah, there's lots of nerve. This is, big, important nerves that run through here. All way more information than you ever need to know, but just for your own interest if you guys find it cool. Anyway, back to Strangles and the relevant information. So the infection causes a marked inflammatory response, and where it gets the name Strangles is all of this abscessation in the submandibular lymph nodes is the most common site that it happens. Horses are going to develop fevers, dysphagia, which is the inability to swallow. So you think they just have a literal mechanical inability to move food or water past it because everything's so swollen in the back of their throat. Anorexia, meaning they don't want to eat. Stridor, that is a respiratory noise. So basically, there's so much swelling that there's a lot of resistance for the air to pass through, and that it can have a respiratory noise. Lymphadenopathy, as I said, so enlarged lymph nodes that may or may not be abscessed. This image up here, this is an abscessed, blown out lymph node. That pus is super, super, super infectious. You drop that on your foot, you go walk through someone's barn, and then your horse licks the floor, or you walk through a shavings bed, and then the horse lays down in the shavings or eats something off the floor, it's probably going to get Strangles. And then by far the most common sign that you'll see is a lot of what we call mucopurulent. So pus is the purulent part. And then muco meaning like mucus, mucoid. So a combination of mucus and pus as the nasal discharge, which you can see here. Strangles gets fun because typically they're usually self-limiting diseases at this point in time. Like we've treated them and vaccinated long enough that it's not usually that severe of a disease. But sometimes horses can develop a condition called bastard strangles. And essentially, this is abscessation of lymphoid tissue and other organs outside the region of the head and the neck. The other thing that can have, so it can also be still isolated to the head and the neck even after it's kind of resolved. So basically, it gets the name bastard strangles because it's a bastard to get rid of. And it's actually been associated, and this is probably not in your references, but it's actually associated with antibiotic use in treating strangles. So a simple, uncomplicated case of strangles does not need antibiotics. They're typically self-limiting. Give them some drugs to control their fevers and just let their body manage it and get over it. And then it should be good. There are cases where in simple cases of strangles and you treat them with antibiotics, it predisposes them to developing bastard strangles, likely because the body doesn't amount a good enough immune response because you're killing and decreasing that bacterial load. But then it's probably hanging out in the guttural pouches. Your body doesn't have a good immune system to it, and then it's going to kick back out and it's going to continuously reinfect itself, meaning the animal. These are some lovely pictures of my friend's horse who currently has bastard strangles. So she classically, a 4-month-old weanling, was purchased out in North Dakota, was put on a trailer, shipped for 2 days to South Carolina. And then 24 hours after she got to my friend's farm, she blew out with nasal discharge and fevers, and then had these lovely swollen submandibular lymph nodes that then you can see here, massive, massive, massive. This is probably all an abscess. You can see this is an abscess that's blown out. And then now I think we're 6 weeks into this. These are probably some degree of edema here, so kind of fluid pooling, but also there's a lot of lymph nodes in this region. This is almost certainly a case of bastard strangles. And I would attribute this case 100% to the early use of antibiotics when it probably didn't need it. However, it gets complicated with this horse, and the horse clinically warranted the antibiotics. We didn't know it was strangles at the time, but here it goes. This is how it happens. Anyway, strangles vaccines. We can prevent it for the most part. There are 2 vaccines that are available on the market. There's a killed vaccine that you inject intramuscularly, and there's also a modified live vaccine. So this is the very classic intranasal strangles vaccine. The modified live vaccine is a mucosal vaccine. So it's pretty short-lived, and it's only providing immunity to that localized mucosa. So you shove it up the nose, which is where you're going to come into contact with strangles most likely, and that's going to sort everything out. In Europe, they only vaccinate with the intramuscular vaccine. It is very, very important that if you are ever given a strangles vaccine to give to your horse, that it goes in the nose if it's supposed to be an intranasal vaccine. If you inject that modified live intranasal vaccine into the muscle, you're going to give yourself or give your horse a large strangles abscess in its neck or wherever you injected it into the muscle. I have seen this many, many times. The other important thing is if you're giving a strangles vaccine, that should be given last after you've given every other vaccine on all the animals that you're going to touch with needles that day, because you can get a little bit of it on your hands, inadvertently touch the skin where you're going to inject, and then inoculate deep into the muscle, and then you'll still end up with a nice muscular abscess. Horses hate having these little things shoved up their nose. If you've ever seen a horse get a strangles vaccine, it comes on a little pipette, and you basically have to be really good at aiming and be really, really fast. It's a ready 1, 2, 3, and then they blow the whole thing back out at you. You literally only need 1 drop to touch their nose to give yourself enough mucosal immunity. However, some people will actually give it in the mouth, And there was a study that's posted down here from, I think it was from, yeah, Kansas State, that you can actually give that intranasal vaccine just squirted in their mouth, and you get a fairly good immune response to it. It's not as good as if you were giving it in the nose, but it's pretty effective still, which is a good thing because some of those horses are very, very dangerous to get strangles vaccines up to, and it's not worth getting hurt over. But if the horse will tolerate it, give it up the nose. Don't just put everything in the mouth. I should also add, and I didn't mention before, but vaccines in general, all across the horse species, are all given intramuscularly. So deep into the muscle tissue. We never give a vaccine into the vein. You will cause a really severe reaction, and the horse is potentially going to die if you do that. And we very, very, very rarely give vaccines under the skin, or what we call subcutaneously in horses, like we do in small animals. So your dog and cat get their vaccines just under the skin, horses in the muscle. We as people get our vaccines in the muscle, but no vaccine ever goes in a vein. Potomac horse fever is another risk-based vaccine. It is an intracellular bacteria, um, and actually, it's more like an intracellular protozoa. It's a complicated thing. It's caused by Neorickettsia, which is this little bug, basically. It's seasonal and sporadic. Outbreaks are pretty uncommon and it's pretty geographically located. Initially identified in the Potomac River Valley, so kind of your Maryland, Washington, D.C., Delaware, things like that. But we see it in Massachusetts. You can see it kind of all over the place, but pretty rare. It is an acute disease and it's potentially fatal, but not always. Um, it This is a really complicated schematic of the life cycle of or the infectious cycle of how it works. But essentially what happens is there's this little bacteria or little protozoal bug that lives in snails, and then the flies typically are going to contract it from them, from the snails. And this is where we associate it with ponds and water and damp areas. And then the birds eat the flies that have the bug in them. And then the birds poop it out and it reinfects the snails. And this is kind of the cycle of how it goes. However, sometimes a horse will come along and accidentally slurp up a snail or inadvertently swallow a fly. And then the horse becomes infected with Potomac horse fever if either that snail or that fly had Potomac. So many of these horses are asymptomatic, and the signs range from kind of like slight depression and lethargy all the way up to, diarrhea, what we call colitis. So this is most of the cases are Potomac horse fever with colitis. So 40 to 60% of those cases. Colic, as always, it's a horse. Anything that can cause colic is going to happen. Laminitis is associated in 20 to 25% of these cases. Abortion has been reported in later months of gestation with Potomac horse fever positive horses, and approximately 5 to 30% of these horses succumb to the disease. If you weren't sure what pipe stream diarrhea was, this is pipe stream diarrhea. They literally squirt pure poop water out of their butts. It's disgusting. They paint the walls. It usually smells horrible, and the horse is usually really, really sick when they present like this. But I just wanted to give you guys a picture to kind of put into perspective pipe stream diarrhea. Mild diarrhea might be like cow patty consistency, not normal formed horse buns, but most of your colitis horses present like this. Classically on the talk, there's a vaccine that we can use to prevent the disease. Ideally, you're going to time it to precede the anticipated seasonal peak, which for most horses in most regions is kind of that late summer, early fall timeframe. Most horses, if indicated, so they live near water or usually only if they live near water, you're going to vaccinate them once a year. Some places will have a single horse that gets Potomac horse fever, and then they always vaccinate after that, regardless. It's kind of a hit or miss. I feel like a lot of people actually don't vaccinate for it. My horses back home live. We have a pond near the property. I used to vaccinate them for it yearly. It's not something that I feel like is actually worth vaccinating for necessarily. There's a lot of debate whether the vaccine is effective or not, but it's available, and it's not wrong if you choose to vaccinate your horse for it. Foals, you want to vaccinate around 5 months of age. MDA, so maternally derived antibodies, are what they're going to get from colostrum, and the incidence of disease are going to affect whether you vaccinate them or at which age you vaccinate your foals, if at all. Yeah. Moving on to botulism, another one of our clostridial diseases. So it's a bacteria the name of the bacteria is Clostridium botulinum. And it's another bacteria that likes to live in kind of anaerobic environments, so kind of lacking oxygen. And it grows rapidly in decaying carcasses and occasionally plant matter. Really, typically, we associate botulism with round bales. So if you think of the dead rat that gets rolled up into the round bale, or the dead bird that gets rolled up into the round bale, and it sits in the middle of the round bale and it does its thing and it just festers and brews. And then your horse comes along and eats it. Well, they just ate a bunch of botulism, and then they're going to probably contract it. Botulism is similar to tetanus in that it's more of a poisoning than an infection. So the actual bacteria, Clostridial botulinum, is not what's causing the disease. It's the toxins that it produces that's causing the disease. So botulism produces botulinum toxins. Um, botul Botox is a form of a botulism toxin. And the way this toxin works is it also works on the muscular blockade, except different from tetanus. Botulism causes what we call flaccid paralysis. So spastic paralysis is tight and rigid, and you can't relax your muscles, where flaccid paralysis is loose and you can't contract them. Botulism gets complicated in horses, as everything does in horses. You can have foals that develop botulism, and we call it Shaker-Foal syndrome. So this is essentially a dysbiosis, or they get a Clostridial botulinum overgrowth in the gut for whatever reason. And then because that botulism is in their gut producing those toxins, the body absorbs the toxins because that's the job of the intestines. And then you see this clinical manifestation in foals. It's usually in foals less than 4 weeks old, and they're going to present with muscle tremors, inability to stand, or dysphagia, and leading to death. Wound botulism is uncommon, but does happen rarely, or occasionally it'll pop up. Typically adult horses, and essentially you're getting similar to tetanus. You get it in the wound heals, creates a perfect environment for it to grow, and then you see the clinical manifestation. The botulism vaccine is very much a risk-based vaccine. Not everybody vaccinates their animals for it. It is very common to vaccinate them out west for it. And really, it's horses that are eating out of round bales are the ones that we think of to vaccinate for. It's a killed virus. It's 3 vaccines initially every 4 weeks, and then annually. And then for dams, you want to vaccinate them again 4 to 6 weeks pre-foaling so that they have good colostrum antibodies for that young foal. I think there is, hold on. Okay. Yeah. So, okay, recap. What do we do here? We don't need to talk about that bit. Sorry, this is very much a piecemealed presentation. So here's a little table to kind of go over your core vaccines versus your risk-based vaccines. So just again, core vaccines, triple E, Western encephalitis, West Nile, tetanus, and rabies. And then the risk-based rhino, or so equine herpes, influenza, strangles, Potomac horse fever, and botulism. Any questions on that? I promise I'm almost done. All right, I'm going to keep cracking on, but if you guys think of questions, whatever, we'll circle back to things. And then diseases without vaccinations. We're actually only going to talk about EIA because I deleted a bunch of the other slides. So ignore anthrax, equine viral arteritis, and leptospirosis. Equine infectious anemia, everybody's favorite. If you are in the social media world, this has been a hot topic recently. It's also known as swamp fever. That's your little buzzword for your horse bowl. It is a viral infection that is typically caused by insect bites or contaminated needles, IV sets, dirty surgical instruments. It's a bloodborne disease. So it is going to cause anemia, so red blood cell destruction, and it's specific to horses. It doesn't really travel long distances, which is a good thing. But if a dam is to become infected with it while she's pregnant, she can transmit it to the fetus. And less commonly, but reported, it can be found in milk and also semen. Some signs may go undetected or they may appear suddenly. So jaundice, which may also, you might also hear the term icteric, which is the same word as jaundice, which is essentially some sort of liver dysfunction causing your skin to turn yellow. It could cause rapid breathing, and that's linked with you're destroying your red blood cells. Your red blood cells are what carry oxygen. So if you have less of those that are carrying oxygen, your tissue is what we call hypoxic, or kind of has low oxygen. So you want to breathe in more to take in more oxygen to saturate your red blood cells with as much oxygen as you possibly can. You might see swollen limbs, so kind of those edema situations, bloody manure. Epistaxis is a nosebleed, and commonly anemia or low red blood cell count. There is no treatment for equine infectious anemia, and euthanasia is the recommended outcome because of how infectious it is to every other horse. There are some ways that you can get around that. So the horse has to live in complete isolation with no contact from other horses. They have to be so many feet, and it's like thousands of feet away from any other horse. They have to live in like mosquito netted areas. Really, is that kind to the horse if we're thinking welfare of the horse? Not really. They're herd animals. Um, they're probably better off being euthanized, um, which is sad, but is the unfortunate truth, I think, of this disease. Some 2019 data showing EIA positive cases in the US. So in 2019, there were 89 positive horses on 38 different premises. Texas, as I said, is the wild, wild west. They by far have the highest number of EIA cases out there. With most of the other states, they're having one case with one farm. Florida had 7 cases on 2 farms. Iowa up here had 10 cases on 1 farm. So again, thinking vector borne. One mosquito is going to bite an infected horse and then go bite another horse and transmit it that way. Or what commonly, and maybe not commonly, but what recently happened in Texas at an equine hospital is there was contamination with IV bags and drawing up from communal IV bags to flush catheters. And they were basically taking dirty needles and putting them into the IV bags and then going to inject other horses. So they were contaminating them and freely inoculating horses. So this hospital had 25 positive horses of EIA, all of which died. There were a lot of really expensive horses involved in it, and the veterinarian lost his license in the state of Texas. He still practices in other places. Should not, but that's neither here nor there. But you can see super transmissible, super easily done. And this is why we Coggins test. So Coggins is the name of the person who developed the test. But there's primarily 2 different types of Coggins tests that are available on the market. So there's an AGID, which is the original Coggins test, and it's a little bit more in depth. Or there's the ELISA test, which is essentially just looking for, in a way, antibodies. And it's a little bit less accurate. So sometimes we get false positives on ELISA. But basically, what happens in all of the labs that test for equine infectious anemia is if you come up ELISA positive, you then go to an AGID, and the AGID is a very reliable test. But 99% of horses, like all of your horses, if you guys have them, or all the horses that you ride, when they get a Coggins test, they get it, and they get an ELISA, and they're all pretty much negative on the first go around. You might see old Coggins forms that are the carbon copy, handwritten. I don't remember. I think the owner got the white sheet, and then the yellow sheet gets submitted to the lab, and then the vet keeps the pink sheet. And if you guys don't know what a carbon copy paper is, basically you write on one sheet and it like copies down through the stack. Or nowadays in the lovely 21st century, we take pictures of horses instead of having to draw them. And I can submit your Coggins forms online, which makes my life a lot easier. So that was Whistle Stop Tour. Maybe not Whistle Stop. That was very long verbal diarrhea of me talking about a lot of the things that you might see as disease or vaccination questions. Do you guys have any questions? Yes, fire away, Kate. So, yeah, I should also start that with saying I'm not trying to rain on Texas's parade. It's just there's a lot of horses in Texas, so we see a lot of things in Texas. But if you are unsure of what your horse's vaccine status is, most of our vaccines that we have are super, super safe. So, and actually, yeah, most of them are super safe, if not all of them. So, for instance, you just bought a horse. Like you said, you have a Coggins, but you have no idea if it's had any other vaccines in its life whatsoever. You in Massachusetts are going to want to give it an EWT West Nile. Your horse always wants to be covered for tetanus. Um, if I go to operate on your horse and it has been more than 6 months since its last tetanus vaccine, I'm going to give your horse a tetanus vaccine. Super safe. You really can't over vaccinate them for it. The mosquito viruses, if they're in a high risk area, you're going to vaccinate them every 6 months anyway. So it's probably okay to give them another one. And same with the rabies. If your horse were to come into contact with rabies and it had been more than 1 month since its last vaccine, we're going to boost your vaccine for rabies anyway. Super, super safe. The rabies vaccine in adult horses is always just one vaccine. We don't have to booster it. It's super effective. For your tetanus vaccines and your mosquito diseases, and also flu and rhino, um, you if it's an adult horse and you don't know the vaccine history, you give it its initial vaccine on day one, and then you booster that vaccine in 4 weeks, just to make sure that you've given that horse's immune system enough of a chance to recognize the disease and build a response to it. They don't need the full 3 series like we do in foals. That's more aimed at we are trying to figure out when the maternal antibodies are declining and when they're building their own immune system. That's why we do foals more often. But an adult horse has, in theory, a mature immune system. 2 vaccines is enough to make sure that their immune system is going to work for it. So the short answer to all of that would be to revaccinate them and then booster them in 4 weeks if you have no idea what they've gotten previously. To complicate that, the strangles vaccine is, I feel like as a horse owner before being a veterinarian, it was always like, yeah, strangles vaccine every year. You actually don't need to do that. And there are actually some very negative side effects to doing that. So if your horse has a high titer to strangles already, and there's a really easy blood test that your vet can run to determine the titer to a strangles vaccine or to strangles in general, um, is if you over vaccinate them or they recently recovered from a strangles infection and then you vaccinated them again, so just continuing to bombard their immune system with it, they can develop an autoimmune disease and like a vasculitis situation called purpura hemorrhagica. Um, and that's very bad. Purpura horses, yeah, very, very, very bad. So maybe if you were unsure about strangles, run a titer. That titer is probably about $200 to run. It's a lot of money, but in a perfect world, that's what you would do. Or you kind of just unpopular opinion, but just skip the strangles vaccine. So that's my professional opinion. Um, hmm, how often? I don't know if I could actually answer that because the population and things that I see and just my take on things, I see the worst of the worst things all the time. So I'm more inclined to sit in my ivory tower and go, well, you should always run a titer before you vaccinate for strangles. Um, in reality, I think most people don't, and most people's horses don't develop purpura. A very, very low number of them do actually develop it. It's just that I see them when they develop purpura, and it's not good. I'd say when it's most beneficial, and actually, I was having this conversation with my friend with this little filly that has bastard strangles. If your horse developed strangles at one point, you know your horse had strangles at one point. And say, okay, I this little filly, she's got strangles now. Well, come springtime, um, most people are going to go, oh, start our show season, whatever, let's vaccinate. That's when I would test a titer to see what is her immune system doing. Because if her titer is high enough, she doesn't need to be vaccinated for it. But if it's low enough, then yeah, okay, booster that. But if it's high enough, you run the risk of complications. I don't know if that made any sort of sense. There was a lot of rambling, I think, on my part. Anybody have any other questions? Yeah. Um, Not particularly. I think so. I mean, I like emergency medicine. I joke that I like the acutely ill and dying. Those are literally my favorite cases. Um, I really like a down horse case. So I've seen a fair number of West Nile horses. They're sad cases. I mean, most down horse cases are sad cases, and most acutely ill and dying cases end up with the latter. But the I don't know, the chaos of down horses is a lot of fun. And a lot of those horses do end up actually having West Nile or EPM. And I never thought I would ever say that because it drives me nuts when people are like, ah, my horse has EPM. Like, probably doesn't. And I think people really like to over diagnose EPM. But yeah, it causes some wild, crazy horses, neurologic horses. That would be kind of probably my infectious diseases that I like the most. But in general, I like a nice colic. That's my bread and butter. Hmm. I can't necessarily answer the PSSM. I think a lot of horses, we kind of know what they're like the predisposed horses to it. You know, it's typically your heavier set draft horses. I mean, it can be a quarter horse thing. And I mean, at this point, all of our quarter horses are pretty much genetic tested if they're registered. So we know their status. But going down the EPM thing, I think it's very dependent on the region. Massachusetts, I have never heard of somebody having a horse with true diagnosed EPM up in the Northeast. That's not to say 20 years ago it was a thing, but for whatever reason we don't see it now. In Missouri, I saw a fair number, maybe not a fair number. I saw some EPM cases, and I think it's a bigger problem out there. And I don't know, it's very geographic to where you're located. The soapbox that I'll stand on is everyone loves to go, oh, well, my vet did a blood test and it showed that they had a titer to EPM. Okay. That's not how you diagnose EPM. That can be suggestive of, does your horse have the symptoms of EPM and its titer is on the higher side? Okay. 2 and 2, that kind of adds up together. But if you want to have a definitive diagnosis for EPM, you need to do a blood test and also collect CSF, so cerebral spinal fluid, from a spinal tap. And then you take those two samples and they get run separately. And then there's a ratio of the two numbers. And that's how we definitively diagnose EPM. The blood test, I feel like, and this is my gripe with everybody, is they say, oh, it's kind of, my horse has EPM because it showed it has a blood test. Horses live outside. We have possums outside. Possums poop where possums want to poop. Most horses probably have some degree of a titer to EPM, but just because they have a titer does not mean that they have EPM. And Panazaril, which is the marquee drug that we use to treat it, is really expensive, and it's also not without side effects. There are people that treat every horse in their barn every spring for EPM. If you have the money to do it, great, but I wouldn't advise it if there isn't an actual reason. I feel like I'm at work right now. You're rounding me, grilling me on questions. Um, Other diseases for spinal tap. Off the top of my head, not anything. Um, I mean, we do in the referral setting, like we do a decent number of spinal taps, um, but that's not necessarily looking always for infectious diseases. Like we just kind of make slides of it and look at what do the cells look like? Do we see, are there bacteria? Like we're looking for meningitis or something like that. EPM off the top of my head without going down like a literature search, whatever, is really the only thing that we use paired titers for. So blood and CSF. You can
I
also
have
ask, oh yeah, go for it.
I have a question that's kind of off topic from vaccines, but you said that you like the worst of the worst, so I figured I'd ask. Do you
Mhm.
have any like personal cases where you've seen equine sarcoidosis?
So I see lots of sarcoids. I have not seen sarcoidosis to my knowledge. I've seen lots of other horrible, nasty, what we call neoplasms, so cancer. Um, I had a disseminated seminoma, which is really rare. We're actually in the process of writing that case up to publish. It was a Frisian stallion who previously had so seminoma is a tumor that derives from the testicle tissue, and this horse had a unilateral castrate or a hemi castration. So they took one testicle, preserved the second testicle for breeding. And then this horse presented to me really, really sick, having focal seizures. His blood glucose level was 26. So like a normal blood glucose should be 90, 100, 120. 26 is really bad because after about 24, you're not alive. And this horse had disseminated seminoma throughout all of its body cavities. It had a small child-sized tumor in his abdomen that when you went to rectal him, you like couldn't get by it. It like pushed you down into the abdomen, which is very abnormal. And they actually did some testing on this tissue, and he's the first reported case of I think it's TNF, so tumor necrosis factor alpha, secondarily causing a paraneoplastic, so aside from cancer, hypoglycemia or low blood sugar. It's the first reported case in a horse. I don't know if that answers your question. I got really distracted by talking about poor Dedrick, but does that answer your question?
No,
Sorry.
that's cool. No, my mare earlier, like way last year, had been diagnosed with equine sarcoidosis. And I tried to like research it, but I had not found it's so like uncommon that there weren't any case studies that were really like
Mhm.
correct to her symptoms because there's so many different.
Yeah, honestly, I'm not really familiar with like we see a lot of like cutaneous sarcoids. We do a lot of surgery on sarcoids, which and that's a whole nother hot topic. But I can't say that I've ever seen like disseminated sarcoidosis, and I couldn't really tell you much about it to be honest, because it's not something that I think about.
I just have to leave a little bit early.
Yeah, no worries.
Thank you so much. This was really helpful.
You're very welcome. Yeah, no, I hope that was good for you guys. I hope it wasn't too over your head or, I hope it was useful. It was almost 2 hours of me just blabbing on. So cool. Yeah, no, of course, I'm happy to do it. Um, I don't know. It's fun in a way, and I hope you guys have fun at nationals and kick some butt. Massachusetts represent. Um, hopefully, oh, that makes me very happy that it's actually useful. Cool. Well, I am probably going to go because I have another presentation that I have to put together that's due on Friday for the surgical conference on my research that I have not finished yet. So, yeah. But no, if you guys have any questions, feel free. I think Kate has my email or, Kate can get you in touch with me. I'm happy to answer questions. I'm happy to send slides over. Just let me know.
Thank you.
Yeah, you're
Thank
very
you.
welcome. Good luck, and I look forward to seeing the results of nationals.
Thank you.
Have a good one, guys.